Good morning. It's Dr. Jeffries again. Today I'll be finishing the talk about the thrush. We have managed to go through the explanation of what thrush is, what causes it, what the symptoms are. Today I'll be talking about how to find out if really you have thrush, and what to do if you have thrush, and what will happen if you don't do anything about your thrush. So very briefly, for those who haven't seen the video from the previous two talks, I'll go through very quickly what the symptoms are. Most women who have thrush just have a very mild form of it, and they have absolutely no symptoms at all. Other women will have symptoms like itching, creamy white vaginal discharge, and soreness. When you have these symptoms, it's better to talk to your doctor and let them make a proper diagnosis of thrush. Now, it's not always that your doctor will do a test, but in some cases, if it's not very clear what your diagnosis is, they may ask to take a swab. A swab just means that the doctor would use a stick, a very small stick, with a cotton wool on top, insert it into the vaginal area, and take a little sample from the discharge that you have. They will then send it off to the labs, and it will be grown for over a few days, and they will be able to tell you whether you have Candida, which is the bug that causes the thrush. Whether or not you've had this test done, if your doctor decides that your symptoms are in keeping with thrush, they will then decide to treat you. Now that takes us to the management of thrush. We have medical management and we have non-medical management. Now the medical management includes things like creams. These creams are readily available in most of the chemists or pharmacies all over the world. And usually they will dispense it to a woman who complains of vaginal discharge. Because of the extent to which we're allowed to publicize, I will not be mentioning any names, but if you walk into any chemist and let them know your symptoms, if they are authorized to, they will sell you a thrush cream. For some people, just applying the cream alone will not make such a big impact. It may be that you need to insert a pessary. A pessary is a form of a rounded tablet that is inserted down below. And you can actually use both the pessary and the cream together. In cases where you cannot use either of these, or you have tried them and things are not better, your doctor may suggest that you swallow tablets. There are usually 2 tablets that can be given. This may be different in other countries, but in most countries of the world, you can have 1 tablet that you need to have just 1, and that will be the end of the treatment. And there is another type which you need to have 1 tablet twice a day, only for 1 day, and that will be the end of the treatment. The tablets are not necessarily better than the cream and the pessary that you insert inside, but your doctor will be able to advise you which one you need to go with. I did mention that there are non-medical treatments for thrush. A lot of people have suggested lots of things. People have suggested using natural yogurt. Other people have suggested using things like bicarbonate and vinegar. Even though some people could swear that this helps them, we have found out that we don't really have a lot of medical proof that this does work. And I will advise strongly that you use them with caution. Also, talking about the non-medical management of thrush, I did highlight yesterday that the hygiene, the personal hygiene of a woman, has got a lot to do with whether you have thrush or not. Remember, Candida thrives in an area that is warm, that is wet, and that is hidden. So you may want to consider how frequently you have Candida or thrush by looking at your wardrobe, the choice of the underpants that you wear, and how tight your trousers are. So if you like silky pants and you like tight trousers and leggings, that may just be the reasons why you're forever itching. Having said all this today, to round up on this talk about thrush, it's not only women who have thrush, men too can have thrush. Thrush is not classified as a sexually transmitted infection, but if you have sex carelessly, you're not only prone to an infection, you're prone to serious infection. So I'll leave you with this note today. Remember, you can take a lot of care about what happens in your body. One, by knowing what is normal and what is not normal. So remind you ladies, the next time you're dressing up, don't just whisk your knickers on. Have a look at what is going inside. A few people have been sending me questions. If you have any questions about any female health problems that you will want us to address on this talk, please feel free to email thypreciousjewels@googlemail.com and we will get back to you. Thank you very much and have a nice day.